So good morning. My name is Tim Caddigan and I'm the chair of the board for the Oakville Chamber of Commerce. We're pleased to have our local MPs, the Honourable Anita Anand, Minister of Public Services and Procurement, as well as MP Pam Damoff, Member of Parliament for Oakville, North Burlington, and of course our guest, the Honourable Melanie Joly, Canada's Minister of Economic Development. Let me first start off by saying that we find ourselves in a situation without precedent for the global and Canadian economy. Physical distancing has impacted our normal chamber operations, but we remain committed to advocating on behalf of our members and finding new and innovative ways to engage with our elected officials, ensuring that our member priorities are brought forward and heard. Our collective focus at this stage of the crisis must be on the immediate execution of government measures. To that end, we're grateful that the federal government has worked closely with the Chamber Network in the development of its initial stages of economic support for businesses and workers. And here at the Oakville Chamber, we thank all of you for taking the time to discuss some of these key issues facing our country during these unprecedented times. The questions I will ask this morning were developed by seeking feedback through a call to action from our membership. We did our best to consolidate your questions, concerns, and themes, and relate them back to the portfolios of our elected officials we have on today's call. So on that note, let's get started. Our first question is to Minister Joly, Canada's Minister of Economic Development, also official languages, I believe, but we'll concentrate on economic development for this morning. Good morning.
Good morning. Good morning, Tim. Thank you for doing this.
Minister Joly, we appreciate you joining us virtually and answering questions put forward by our membership here at the Oakville Chamber. Government at all levels has a reputation of being slow-moving, known for studying programs and policies for months, if not years. And during COVID-19, you've had to roll out programs and policies in days and weeks that sometimes would take months to years. Can you give us an overview of some of these programs that have been designed to support businesses?
Good. Thank you, Tim. Thank you, Anita. It's great to have you also on this conference. So obviously, as we are really working on containing the spread of the virus, one of the main objectives of the Government of Canada was to really help people really follow the rules of public health authorities. So our biggest economic approach is to make sure that there is physical and social distancing and making sure that people can really flatten that curve altogether, because that's the best way for us to afterwards rebound and make sure that we can have a strong economy again, and to lower the time that this period will last. Following that, we wanted to make sure that we would expand massively the social safety net, because people should not be asking themselves whether they have, they can pay their rent, mortgages, or put food on the table. So we came up with CERB, which was basically using the existing program of EI, because at this point we had no time to create a new program, and all our public services teleworking, and we expanded its definition, and now it's the Canada Emergency Response Benefit, and we started sending bank transfers as of this week. And then following that, after doing this, well, then we were ready to really help bring up our economic package. At the beginning, our reading of the crisis was a bit different, I must say. We thought this was just a moving demand, where people may not sell furniture, for example, if it's a furniture company, for maybe two months, but eventually would sell more furniture. And we thought it was really, the issue was liquidity and helping businesses, deal with that really important cash crunch. And that's why we worked with the banking sector, and we released more liquidity through banks. And that's why people listening to us, if they have any questions, their first, reflex should be talking to the banker. And so, and that was our first reaction. We put more money into the BDC and EDC as well. And afterwards, looking into that and seeing how much this was having a profound impact on our different main streets across the country, and definitely in Oakville as well, we came up with subsidies. And that's why we decided to develop this new approach with wage subsidies to make sure that businesses could keep their employees, and not only keep their employees, but also making sure employees have access to their benefits that they've worked on, for so long. And so we've been really working with many chambers across this country, like we were saying, Tim, to refine our approach bit by bit and make sure that nobody would fall into the cracks, but we're moving quickly. And while we're moving quickly, we know we can cover 80% of cases, but we need to deal with the 20% of cases. And that's why, the wage subsidy was amended yesterday. I can answer questions from you also on specifics regarding the wage subsidy, which is 75% of all your wages up to $58,700 max per salary per employee. And you have to show 30% losses. There are certain other conditions. Also, we came up with $40,000 grant loan, which if they are reimbursed within 2 years, businesses can keep $10,000. And also, we make sure that we would be doing tax payment deferrals to make sure that that businesses can keep their cash in their pockets. So that's what we've done, and I know that my colleagues have, particularly Anita has worked a lot on procurement also, and that may have impacts in Oakville.
Yeah, and we'll touch on that in a little bit. You talked about how quickly things are moving, and anytime that government tries to do something this quickly, obviously there will be problems. It's such a fast-moving process. Can you touch a little bit on how nimble the government is in its ability to change course and to make corrections as you navigate this whole process? How fast can funding get into the hands of Canadian employers and employees?
Very quickly. And we're showing that this week because the $2,000 CERB benefit just started, this week. People were registering on the Canada Revenue Agency account, and basically they got their money within 2 or 3 days. So it's working. So the idea for the federal government was to find the quickest way to send the money. And so that's why usually this would be tax filing season. Right. And people are not sending their taxes as much. So the CRA had the firepower, like the capacity to make sure to deal with millions of transactions. So that's why we wanted to do the CRB first, and that's moving very quickly. And then next is the wage subsidy. Obviously, we need to have the wage subsidy measure passed before Parliament. I know that my colleague, Minister Morneau, is working extremely hard on that.
So I think certainly it's commendable how fast the government has put money into people's hands. The one, I don't want to say criticism because that's not the right word. The one observation that I think some people have had is that they've received money but without explanation. And in fact, they're not able to get through on the lines because you're dealing with millions of applicants. Is there a way to communicate to people when they receive those funds what they are? I read one report where somebody said they received funds but they didn't know if they were actually supposed to, so they felt like they couldn't spend that money.
Okay, so there's that are being sent people. There's the Canada Child Benefit that has been increased. So if you're a parent and you've received $300 more for your child, which this is this is the Canada Child Benefit increase due to COVID-19. The other thing also is the tax GST credits. So we've sent checks all across the country, and these checks are arriving as we speak. And then there's CERB, CERB, and that's an amount for a total of 4 months of $8,000. If people have received under the Canada Emergency Response Benefit more than $8,000 over 4 months, well, they have to tell to the Canada Revenue Agency. And trust me, never underestimate the Canada Revenue Agency. So meanwhile, we just wanted to send money as fast as we could because people are dealing with everyday realities, important needs. They are stressed, anxious, and they need that money to feed their families. So that's why we went fast.
Thank you. Minister Anand, similarly, we're seeing the country's purchasing requirements reach an unprecedented level. And as a country, we are facing the challenge of securing medical supplies to support our frontline healthcare workers and ultimately the economy. How do you stay on top of that demand?
Well, first of all, I just want to thank you so much, Tim, for having me on today. And I have missed so much speaking with people in Oakville in person that this is actually a compromise measure, I guess. And I just want to thank you for arranging this town hall. It's wonderful to be able to be here with you today. You are correct. Countries around the world are struggling to procure personal protective equipment, and the economy and the supply chains surrounding this equipment are extremely tight. The demand is incredible. Having said that, we are working night and day to make sure that we are procuring the PPE for frontline healthcare workers. What does that mean? That means leveraging existing supply chains. That means working with domestic industry to retool, to build up their manufacturing capabilities. So what we've done in that regard, for example, is we've been working with well over hundreds of suppliers to make sure that that is something we can deliver. Canada Goose has stepped up, Bauer has stepped up, Stanfield's, Thornhill Medical, Medicom in Quebec, Spartan Medical in Ottawa, the list goes on. And I am heartened by the response that we have received from domestic suppliers and international suppliers to make sure that we can get those supplies to frontline healthcare workers, which is exactly what we need to do. In addition to that, the provinces and territories and the federal government are working very well together for a Team Canada all hands on deck approach. I spoke with my ministerial counterparts late last week, and we'll speak with them again next week to ensure that once we get the supplies here in Canada, they are distributed out to the healthcare workers that need them. And in order to create more efficiencies in the supply chain, we have partnered with Amazon Canada, Canada Post, and Purolator so that the deliveries on the ground here in Canada are that much more efficient. Once again, it's Team Canada, all hands on deck, and it's been wonderful to hear from suppliers in Oakville as well, almost every day, in terms of what they can do to step up. So I just want to say thank you to them as well.
You know, I think for many Canadians, the whole Team Canada approach has been a sense of pride and something not surprising in this country. My question would be, how do you, because you're seeing large quantities of PPE now arriving, how do you decide to distribute that? Is it by population? Is it based on the modeling that the provinces are now putting out? You know, yesterday, BC is saying that they feel like they've largely flattened the curve. So how do you decide how to distribute what you have right now, which they're large quantities, but still not probably to the level of demand we have across the country?
It's a really great question. So every single day, we procure goods based on requests that have come to the provinces through the Public Health Agency of Canada. And that's what we are so committed to doing. Over and above those requests that have come directly from the provinces, we say to ourselves, we don't know what course this virus is going to take in Canada, so we have to be over-prepared. So we go over and above those requests and place bulk orders in vast quantities in China and the United States and around the world so that we can make sure we have the goods on the ground. In terms of distribution, there is an agreement based on discussions that Health Canada has had with the provinces and territories, and the distribution takes place on that basis, generally speaking. However, if there is a place in our country, because this virus is attacking regions in very different ways at different times, then we want to be prepared to assist those regions also. For example, 392 orders of personal protective equipment have already been shipped to our Indigenous communities. In addition, there was a region that was in short supply of gloves this week. So we made sure we got gloves out to them. So we are utilizing all means possible to make sure that the provinces and territories are served very well. Remembering also that we have the national emergency stockpile that we want to make sure is replenished, so that when regions of our country are in need, they can reach out. I was also very heartened to see that right here in Oakville, there are people who are gathering PPE, the Halton District School Board, for example, in order to distribute the PPE out to frontline healthcare workers and beyond. So we really are all stepping up to do our part. Everyone is so caring in our community and across this country, realizing that we want to minimize the spread of this virus and do whatever we can to help those people in need. And again, I just wanted to say thank you, and to say that from the federal government standpoint, we have put $2 billion into the Public Health Agency of Canada so that we can continue to do the procurements that we need, build up the stockpile, and get those goods out to places in need across the country.
I think, you know, the whole crisis has taught us that cooperation and is essential really to getting through the next few weeks and months. And I think that, you know, for me as a bit of a political junkie, watching the various levels of government and their levels of cooperation has been truly fantastic to see. MP Damoff, as a former councillor, you have a unique perspective of the role of other levels of government that are involved during the crisis. Last week, there was a feature in the Toronto Star that quoted our Deputy Prime Minister, Chrystia Freeland, suggesting Ontario's Premier Doug Ford was like her therapist. And locally, you and MPP Triantafilopoulos are working closely together, issuing joint news releases and participating together in town halls. Talk to us about this Team Canada approach and how each level of government is required to work together to get us through this crisis.
Well, thanks, Tim. And as my colleagues have said, thanks first to the Chamber for organizing this. And I also want to recognize that we're on the traditional territory of the Mississauga of the Credit First Nation as we're gathering here today remotely. And you're right, it's actually something I think Canadians are really happy to see, the way the different levels of government are working together. And quite frankly, it's critical that we do. And last week I hosted a teletown hall. We had over 4,000 people who joined in on the call, and had Effie Triantafilopoulos, the provincial member. I had both Burlington and Oakville mayors on the line, as well as the CEO from Joe Brandt and the head of infectious diseases at Joe Brandt Hospital. So, you know, just the feedback that I got from that was tremendous. And you know, I think we need to be working together, and I think Canadians expect us to work together. And you've seen my colleagues federally working with their provincial counterparts and municipal counterparts, as well as with local healthcare, and quite frankly with not-for-profits and charities as well, to see that we just provide a great big security blanket for Canadians as we as we go through this this crisis.
Thank you. Minister Joly, I want to circle back with you. At the top of the webinar, you expanded on some of the details around the wage subsidy program. And as the issue continues to be a top concern for our members, will the government be considering further measures to assist small businesses who may not be able to qualify for the subsidy under the current program? And so I'll give you an example. Businesses who have been ordered shut and have no business in which to employ anyone.
Mm-hmm. So different things. First and foremost, we've made some significant changes even yesterday to the wage subsidy. So there's that famous criteria of 30% of losses that need to be shown by businesses to have access to the wage subsidy. Now, this criteria has been changed yesterday to make sure that for the month of March, it's not 30% you need to show, it's 15%. Also, if you want to be able to use a way that would be maybe better suited for your business, you can show the difference between January, February, and March, and really making sure that you can show that 30% of loss rather than only March 2020 to March 2019. And also, there are two accounting methods that can be used, which is basically accrual accounting or either cash accounting. So that may help some of the business that are sometimes a bit more seasonal or don't necessarily have the same type of accounting. We hope that these are, these measures are landing well. Also, we announced that for all the employer paid contributions to EI or CPP would be reimbursed 100% by the federal government should businesses decide to use the wage subsidy as they're rehiring people that maybe they've laid off since March 15. So, this shows, Tim, basically that we're listening and we're acting. We've heard definitely that the startup were not covered enough, and so that's why we changed our method. We heard also that very high growth companies were really impacted, because it's not as if that their businesses was not suffering. It's just that the business was going so well before, so we had to take that into account. And also some seasonal businesses. And so we hope that these different changes will have an impact, and not only a positive impact, but fill more gaps that we were seeing. And I look forward to, and I'm asking you the question, Tim. How can you can please gather that information through your members to see whether it's a positive response, whether we're covering more cases, and what's left, because that feedback would be very helpful for Anita, Pam, and I as we're speaking to the Minister of Finance and making sure that we are really working on tweaking the legislation that will be put for the House of Commons, we hope, very soon.
Okay, thank you for that. I appreciate that. And we will gather that information. We are hearing from our members on a regular basis. I think one of the concerns really is around understanding the timing and when people that run these businesses can apply for the funding.
Yeah, okay. So two things. First, as soon as the legislation is passed, then, it will be a how can I say, a real measure. And therefore people will be able to go to the CRA My Business account. So it's on the website. Also, I would encourage people listening and watching us. Things have been moving so fast. Obviously, sometimes it's difficult to follow. We now have a new partnership with the Canadian Chamber of Commerce, and people can go on CBRN, Canadian Business Resilience Network, cbrn.ca. And I hope you can share that website address with everybody, because you can have the latest on everything we're doing at the federal level. Obviously, also, this is a time where your accountants are key, because they can provide you the information. And also, if you still have a liquidity crunch and you didn't want to talk to your banker because you're scared of the reaction, maybe your businesses was not perfect before, and then you just don't want to, you're scared of the reaction, please go see your banker. Look at the options, see what's available to you, because, we don't want you to go down right now. We want to make sure that we help you keep your business, and that we're your ally in these dire times, and we can help you bounce back afterwards.
We'll send that website out to our members today. Thank you.
Thank you.
Minister Anand, last week, we saw the US president call on 3M to halt the export of medical supplies to Canada. Under that order, under President Trump's order, the acting Homeland Security Secretary will work with FEMA, and I quote, to prevent the export of N95 respirators, surgical masks, gloves, and other personal protective equipment. Now, fortunately, that storm appears to have passed, and it seems to have been resolved, and 3M has continued to deliver masks to Canada. However, I'm concerned, or I would question how that complicates the situation when our largest trading partner is trying to disrupt the supply chain and ultimately our access to the protective gear we need.
Thanks so much, Tim. I have been getting a lot of questions about 3M over the last few days, so I'm really happy to be able to speak to this point. The first point we've got to remember is that 500,000 masks and 95 masks did arrive in Canada and are being distributed to the provinces. When we have a shipment from China land in the next day or so, the total number of N95 masks in Canada is expected to be 2.3 million, which will be distributed to the provinces. So we are, as I mentioned, leveraging existing supply chains and creating new ones and making sure from start to finish that these products get into Canada. On the subject of the relationship with the United States, the very first point I'd like to make is that our economies are intertwined. We actually export more medical supplies to the United States than we import. And so you can see that there is a mutual dependency there. And that is very important in the diplomatic efforts that we are making and will continue to make when we are faced with situations where we're concerned about the goods coming across the border. Rest assured, this is a full court press on PPE. Whatever we can do at whatever moment to utilize existing diplomatic channels and communications with the corporation, as we did with 3M, is going to be fundamentally important to making sure the goods get into Canada where they need to be, and ultimately in the hands of our frontline healthcare workers. That is my biggest preoccupation these days, because here in Oakville and across the country, we are in an urgent situation of wanting to make sure that the PPE is in the hands of frontline healthcare workers where it needs to be, and also that we have an existing stockpile in case of emergencies in other regions of the country. And so the relationship with the United States is important, but let me tell you that it is only one of a number of relationships that we are focused on. For example, in China, where a large number of goods exist that we have procured, we are in touch every day with the Canadian embassy there. And I speak with Ambassador Barton very frequently to ensure that his team on the ground is able to help us in getting the goods to our warehouse in Shanghai, running quality assurance and controls on those goods, working through the bureaucratic channels that have been in place in China to get those goods out of country, and then ensuring that the transportation that we have arranged works fluidly on the ground in China to make sure the goods get back. Every time a plane from China lands in Canada, I breathe a sigh of relief, because it means good news for our frontline healthcare workers. And I will tell you that this is a Team Canada approach, as we've been talking about today, and it is really, really fundamental to remember that our supply chains are domestic and international, and that the United States is one facet of it, but there are multiple channels that we are working at the current time.
I was glad to hear you touch on the quality assessment of the goods that you're receiving. You know, lots of reports about goods coming in from China that were bogus or were not up to the specifications required for PPE. So are you doing that inspection there? What's the lag time to get a mask from China once we have it in our possession to get it into service, versus I'm assuming, and again, this is an assumption, that the stuff coming in from 3M in the States is probably pressed into service immediately?
So there are multiple ways we assess quality control. In China, for example, we have people on the ground. We've retained private firms in China to make sure they can work with Ambassador Barton's team to address quality assurance issues. We also have the Public Health Agency of Canada working in Canada on the ground when shipments arrive to do another check of quality assurance and quality control. And so it's really a two-step process, and it is working relatively quickly so that goods can get turned around and out the door. And that's another reason why we brought in Amazon Canada, Canada Post, and Purolator, so that right away, once the quality assurance is done and the goods are counted, they can get out the door and to the provinces that need them. So it's a two-step process, Tim, and so far it has been working well.
Good, thank you. MP Damoff, as you know, Oakville has a very strong and vibrant and engaged not-for-profit and charity sector. Minister Joly mentioned earlier the support for those in the nonprofit organizations and registered charities, and that they will receive when it comes to the wage subsidy. However, the government is also considering additional support for nonprofits and charities, particularly those involved in the frontline response to COVID-19. What can we expect to see, or sorry, when can we expect to see those additional supports to be announced, and what might they look like?
Thanks, Tim. And you're absolutely right. I mean, to be honest, we're not only considering it, we've already put money out the door for a number of these things. So obviously yesterday, the wage subsidy was amended to better support not-for-profits and charities who are still able to employ staff. But we've announced $9 million to United Way of Canada, and that will flow through in our area to United Way, Halton, Hamilton, to support seniors, where they're delivering meals to seniors and supporting them in their homes. And I spoke to Brad Park earlier this week about how that's going to flow through into our community. There's $100 million that's going to be going to support food banks across the country. And locally, we know Food for Life is working with I think all of the food banks in our community to support them. And, you know, we've got people right now who are turning to food banks who've never used a food bank before in their life. And I think it's important for them to go there. And Halton, there's a website, it's halton.cioc.ca, that has a database of all of the food banks, all of the community supports actually. We gave $7.5 million to Kids Help Phone because we know that homes are not necessarily safe for a safe place for kids. They're not in school right now. There's $50 million that is going to women's shelters and sexual assault lines, and we expect that our local organizations like Savas and Halton Women's Place will benefit from that. And then there's $157 million that's been announced that's going to Reaching Home for homelessness initiatives and those who are really struggling. So those are initiatives we've already announced. So what we're trying to do is get money out the door as quickly as possible in the most urgent way possible. But we do know that the not-for-profits and charities in our community are struggling right now because they're not able to have any revenue come in. They're struggling with fundraising. And we do know that over the longer term, there's going to be help needed for those. But right now, we're not at that phase. We're trying to get funding to the most vulnerable in the quickest way possible. I think we've done a good job of that in seeing this funding flow out the door quickly. But you know, we've been fairly nimble, in fact, very nimble in adjusting programs and ensuring that the organizations that need the money quickly are getting it. So I think we will be seeing more, Tim, but right now we're not even in the stabilization phase. So to look at recovery is just a little bit too far away, but we will be there. Something I forgot to mention when I was talking about the Team Canada approach too is that I'm doing a daily email update. If anyone does want to sign up for it, it's at mpdamoff.ca, and there's a button to sign up for it.
Good, thank you. Mr. Joly, when your government began its second mandate this fall, no one would have forecasted that globally we would essentially be in an economic shutdown a few months later. And the COVID crisis has required the government to shift priorities and focus all of its efforts on our response and recovery. We're spending a lot of money, and there's undoubtedly more funding that is needed to see our economy through. What is the plan for economic recovery, and where will we be in a post-COVID world? So not an easy question.
No, and I think, you know, obviously this was a conversation during the last election, but this was not a conversation, Tim, that we thought we would be having during our lifetime. And so I think Pam just referred to it. We're in the stabilization phase right now. We want to put money in the pockets of Canadians while they're trying to make ends meet. And so that's why the CRB, the $2,000 amount per month, is key. That's why wage subsidies, we need to really make sure that companies have access to wage subsidy. Good news, Air Canada decided to use the wage subsidy and has rehired more than 16,000 people. Same with WestJet this morning. So these are good examples, but my preoccupation is, yes, big companies, but also protecting our main streets, like I was saying. So really making it, it has to make sense for people in the streets of Oakville. And so now, obviously, there will be a recovery and a stimulus package. Like I was saying at the beginning, we saw that there was a movement in the demand, while supply would be still quite high. But bit by bit, we were seeing that this was affecting all the sectors of the economy, and that's why we came up with subsidies. We still think that there are certain sectors that are more impacted than others. Oil and gas, obviously, is really impacted. And the tourism sector. I've happened to be the minister also in being in charge of the tourism sector. And I think they were the canary in the coal mine because they were first affected, particularly elsewhere in the country, like in BC and Alberta, when the tourism, Chinese tourism went down because of the flights that were being canceled because of the pandemic starting in China. And then eventually, right now, obviously, the hotel occupancy rate is less than 10% all across the country. So, and there will be challenges also for them to recover. And so that's why there are certain sectors that we're having conversations about. And at the end of the day, well, yes, there will be a stimulus package and conversations have started about that. I think my message to you and your members is, the economy is, yes, based on the supply and the demand and, direct inputs, but it is also based a lot on emotions and confidence. If you look at how financial markets work, 1/3 of it is really based on data, and 2/3 is based on consumer confidence and really the emotions of markets. And we've been seeing that, quite frankly, a lot recently. And so, we're putting all this in place for people to use these measures. It's not as if we don't want to, have wage subsidies apply to businesses. We want employees to use that. That's the best way to bounce back. And also, I think that people watching us can be can trust the fact that we've got their backs. We're working hand in glove, like Pam was saying, with provincial counterparts and municipal counterparts. We're helping on mitigating health risks with PPE, like Anita was talking about, but we will help you cross that bridge, and we will be on the other side of the bridge, and things will be brighter. So I think that should be the mindset we have all as we're going through this.
When you say across the bridge, I want to explore that a little bit more. And I pulled a quote from the Prime Minister from yesterday where he said, and I'll quote, "At some point when we are easing some of the measures, we will have to continue to be very vigilant about our own behavior in returning to work to ensure we won't be facing a new epidemic or even worse." And I won't put you on the spot to try to interpret what the PM was suggesting. However, I do want to explore how businesses come out of the crisis. And you touched on the larger businesses. Consumers now obviously have the option. They can order many things online, but the bricks and mortar stores, I think you called it Main Street, they may struggle for many, many months. And it's a personal passion for me to see them succeed. These are our neighbors, they're the members of the chamber and our community. How do they recover? And I would say they are not an essential service, but from my perspective, I see them as an essential part of the community.
Yeah. So I won't try to, interpret what the Prime Minister has said, but what we know is that there's still no vaccine against the virus and no treatment. And therefore we have to be very careful because we see that in other places in the world, there are surges of COVID-19. And everything bad that is happening, one of the, good things is the fact that we're at the end of the spread of the virus around the globe. So we can see what Asia is doing and what Europe is doing, and as they are bit by bit starting again to, start their everyday lives bit by bit. But definitely, to your point about the retailers and the local retailers, there are different initiatives that are being put forward. You can hear from my accent, I'm not from Oakville, but in Quebec yesterday, the Premier announced that he would be supporting a online platform that would put all the retailers on that platform, and it's called the Blue Basket, Panier Bleu, and people have been going on that because they want to support local retailers, and that's an example that was taken from France. So I think there are local initiatives and regional initiatives that can be put forward, and definitely being the minister in charge of the economic agency that is called FedDev in Ontario, we could support these, really good ideas, entrepreneurial ideas, because yes, we need to do more for our retailers, and we need to help to consume locally, because that's how we'll have a lot of impact.
Thank you. We just have a couple of minutes left, but Minister Anand, I know you touched on this earlier. We're seeing a lot of businesses here in Oakville and across the country pivot and join the fight against COVID-19, doing what they can to support the production of critical supplies. How can businesses help support our country's effort, and what type of help is most urgently needed?
Tim, I want to answer that question, but I just want to say that when I hear Melanie and you and Pam talking about Oakville businesses, I'm pining to go downtown and be back in the fray with our business community and the people all across Oakville. So really anxiously awaiting that time when we can all be back together again. How can businesses help out? Well, right away, what we did is we set up a website, buyandsell.gc.ca. We have had over 22,000 businesses domestically and internationally reach out to us and offer to assist us in the production of existing supplies and networks or in retooling. And I will say that is an example of how businesses across the country and in Oakville can voice their concerns and voice their willingness to step up. In addition to that, I hear from Oakville businesses through my MP office and email account almost every day. It is incredible how many businesses we have here in Oakville that are actually in the business of PPE production. And I just wanted to thank them for reaching out to me also. And I'd also like to say that I want to hear from you. I'm your member of parliament, but I'm also the minister that is procuring this personal protective equipment. So I have a double duty here to make sure that we are hearing from businesses in Oakville and across the country as we have been. The example that we heard earlier this week of 3 companies starting up to retool and produce ventilators is an incredible story. 10,000 ventilators each, and it's going to be a very important moment in Canadian history when we can say that we've got a full-fledged supply of domestic production in addition to the international items that we are procuring. So once again, businesses in Oakville and across the country have really already stepped up, but of course, our lines of communication are always open, and I would really love to hear from you and your members about any further ideas they have. I've already heard from so many people. Pop-up hospitals, for example, came to me a few weeks ago, and I would really love to continue hearing those important measures of support that can be lent.
We have to close. I'm going to bring you all on screen just before we do. I think both Anita and Pam, you've described this community so well, that it is so very special. And Minister Joly, we look forward to having you back in person so you get to experience not only our tremendous business community, but just what the community in general has for you.
Thank you, Tim. Thanks for your
Thank you,
leadership.
Tim.
Thank you,
I
Tim.
want to thank Minister Joly, Minister Anand, and MP Damoff for joining us for the first webinar in what we were calling our COVID conversation series. There'll be more information to follow on future episodes of this. We appreciate you taking the time out of your busy schedules for what we believe was a very important conversation for our members and our business community. And to everyone who's watching on Facebook Live, on Zoom, and on your TV, thank you for tuning in. Thanks again, and have a productive day.
Thank you, Tim.
Thanks, Tim.
Thank you, Melanie. Take care.
Bye all.
Thanks, everybody.